Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Chris Peterson, a well-known local dentist and the founder of the Wisconsin Tongue Tie Institute in De Pere, Wisconsin. Dr. Chris specializes in releasing tongue and lip ties for patients of all ages with a special focus on infants. His journey into this specialized field comes from personal experience, as his own daughter Audrey had a tongue tie, and as a dad, he had to navigate the challenges firsthand. Since having his own practice, which started in 2017, Dr. Chris and his team have and continue to make a significant impact by offering not only oral tie revisions, but also in-house support for lactation, myofunctional therapy, speech therapy, and more. Beyond his work, Dr. Chris enjoys spending time with his wife and 3 kids, hunting, fishing, and cheering on the Packers. We're excited to have him here to share his expertise and to answer a lot of your questions related to tongue ties, orthodontics, mouth breathing, lactation challenges, sleep apnea, and more. So without further ado, let's dive into today's conversation. Hey everyone, welcome back to the podcast. Today we are really excited to welcome Dr. Chris Peterson from Wisconsin Tongue Tie Institute. Welcome, Dr. Chris.
Hey, thanks for having me. Good to be here.
Yeah, you are well known in our community as an expert in the tongue and lip tie field, and so we're excited to dive into your expertise. But before we do that, we always love to start with a fun fact so we can get to know you a little bit as a person. And you shared with us that you played 4 years of college basketball. Why don't you tell us about where you were playing and more about that experience?
You know, that was, to this day, the hardest thing I've ever done. And I say that more than having kids, more than starting a business, more than, the grad school. Basketball combined with college and trying to get good grades and the pressure of that and balancing your time. And maybe it's because I've gone through all the trenches now and I know what hard work is, but that's what taught me what hard work is. So that was a big learning curve for me. I was the best player on my high school team by just walking on the court. In college, I was the worst one when I walked onto the court.
Humbling experience.
Freshman. Yeah. Big time. So that was a lot of work. And then junior year, finally got into the lineup, and we won a couple conference championships and a couple NCAA tournaments that we played in, and that was Division III, right? You know, when kids hear that I play college basketball, they say, "Oh, did you play for Duke?" I'm like, "No, I didn't play for Duke," but similar stuff.
So super close.
Close enough.
Yeah, no, that's awesome. That's great. And I appreciate you sharing that, like, it was hard, because I think a lot of times people are like, "Oh, wow, you were really good." And they kind of put that on a pedestal. But also at the same time, that was a really big challenge and learning experience for you. Do you stay in touch with any of your teammates?
There are a lot of from out of state. And I got a text actually this week and this makes me feel old, my gosh. My coach sent out, he still coaches there, and he sent out a picture of my senior class, and there were 7 of us. I still think it's the biggest senior class that actually went through all 4 years together in the last 20 years probably. But he sent the text to all of us, and it was a picture of him and us and his son was probably in 3rd grade or something like that. And he said, "Hey, it's this guy's senior day this weekend." So he's at St. Norbert playing, and he's a senior already. That is craziness. He probably wasn't 3rd grade. I don't know. Do the math on it, but he was tiny, and now he's a senior in college, and it just makes me feel a little older.
Yeah. I mean, it's happening to all of us. You're not alone. Well, thanks for sharing that with us. But before we also dive into tongue and lip tie specifically, which is going to be this episode's topic, we also would love to hear a little bit about how you became interested in dentistry in the first place, but then also your specialty. Not every dentist looks at tongue and lip ties the way that you do. So tell us a little bit about your journey.
Yeah, absolutely. So, like I said, I went to St. Norbert for 4 years and had every intention of not just becoming, but becoming a banker. Okay.
Oh, okay.
So my dad recently retired as he was president of Stevenson National Bank up in Marinette, and he worked his way up to that and worked his butt off. And he also is the one that showed me what hard work is, and I owe a lot to him for that. But yeah, I had every intention of being a banker, so I went into business, the business major field, and I graduated with a business major. But it was about halfway through my sophomore year, and he had an honest conversation with me, and he said, I have some friends that are dentists, and I think maybe you should just hang out with them, just talk with them and see what they do, and I think you'd like it because you're good with your hands and you're good with people, and you can run your own business if you want to, and so yeah, that kind of started the ball rolling, and I shadowed a couple dentists in the area, and I was hooked. I never ever thought, people asked me in high school, I was like, I'm not going to be a dentist. Like, I don't want to be in stinky people's mouths, and or stinky mouths, and but it's been great. It's not at all like that. I get to hang out with people every day and run a business and grow that, and the challenges of that are the most challenging thing, but the dentistry is fun, and I'm glad I chose it.
Yeah, that's awesome. And so you became a dentist. Did they teach you about tongue and lip ties very much during dental school? Is that something you've had to kind of pursue on your own? And you do still do general dentistry as well, family dentistry? Yep. Okay. Mm-hmm. But then Wisconsin Tongue Tie Institute is also a huge passion of yours. So how did you get led into that?
Yeah, great question. So I had zero intention when I went into the dental career or profession of going into tongue and lip tie stuff. I had no idea what that was, even through dental school, like you alluded to. Very little. I'm not going to say zero education on it, but very, very little, maybe a lecture about how oral surgeons do tongue tie releases. And that was pretty much it. And that was with scissors and scalpel and stitches and all the things. But after dental school, I did a 1-year residency at the VA hospital in Milwaukee for 6 months, did a ton of oral surgery, placed some implants, did root canals, a whole bunch of stuff. And then 6 months at the VA hospital in Green Bay doing general dentistry. And that's when I met Dr. Fritchie at Pere Smiles and had some good conversations with him and started working with him, and then eventually took over. And it was that same month that I started with him that my oldest was born. Same month. It was a big month. And we had some difficulties with breastfeeding. And as new parents, we're like, is this normal? Should we have a kid that's crying all the time? And should it be painful to feed? We don't know.
Right. You didn't know.
Yeah. So I can sympathize with those parents that we see every day. And that's what I tell them. I've been there. So that's why I'm so passionate about it, is like, I want to help you, and that's what keeps me going. And I keep learning about not only breastfeeding, but growth and development, airway stuff. But to answer your question, that's where it started, was Audrey, my oldest. She's 8.5 now. And after she had a tongue tie release with a local provider with the scissors, we had some improvement. And we thought, oh my gosh, there's something to this. And okay, is a scissors the best tool for it? Well, we just happen to have a Solea laser, a CO2 laser, the best tool in the world, by the way, for the procedure. I mean, any CO2 laser is right up there with the Solea, but we had that in our office. So I was like, let me get some training on this and see if we can kind of provide that niche for the community, because we had to wait 4 weeks to get in with that provider, and we suffered for that 4 weeks, and we didn't even know if it was going to help, but it ended up helping, and it was worth the wait. But we're like, you know what, let's get people in a week if we can, if we can start doing this. So went to Boston for training, went to Scottsdale for training on the laser, went to Portland for training on infants and breastfeeding and stuff like that, and started doing releases 1 year to the day that my daughter was released. It was September 15th, 2017. I still remember the name of the patient and everything like that. And yeah, it's been a fun ride ever since.
Yeah, that's great. And you, like I said in the intro, I feel like you've really become well known in this area now. So thank you so much for doing what you're doing. But we do want to learn a little bit about tongue and lip ties. I think a lot of families have heard about them. If they've experienced something like you, I actually have a very similar experience to you with my daughter specifically. She had a release done. My son, he has a tongue and lip tie still because it wasn't evaluated, and we struggled with breastfeeding. And so I relate very well to what your family went through. But what is a tongue and lip tie, and are there different kinds?
Yeah, absolutely. So we get that question a lot, and we always start our education process when the families come in with terminology. What is a tongue and lip tie? What the heck is it? Because sometimes parents come in and they say, yeah, my doctor said we all have tongue and lip ties, but they don't cause problems. And that just kind of irks me a little bit, So I say, well, let's all get on the same page. A tongue tie or a lip tie or a cheek tie, when you use the word tie, that means problem. Okay. So we all have that strand of tissue that connects our tongue to the floor of the mouth. That's what the doctors are trying to say. And we have that strand of tissue that connects our upper lip to our jaw. And same with our upper cheeks, lower lip. They're kind of everywhere in our mouth, holding everything together, covering different muscle attachments. We all have it. Absolutely. Is it a problem on everybody? Absolutely not. Most people, it is not a problem. It provides support for our mouth pretty much in those muscles. But when the tissue is in excess of what it should be, and it limits the movement of the muscles or the lip or the tongue in a structural way, and we have functional issues because of that, breastfeeding, bottle feeding, eating solid food, speech, dental development, breathing, sleeping, I could go on and on. If there's issues with the frenum, we label it as that tie. So I always start with that just to make sure we're talking the same language.
So if somebody comes in, I'm sure there's different degrees of ties.
Absolutely.
So what dictates if it needs to be released or not?
Great question. And that's what we think separates us from, when I started this whole thing, let me back up. I was just a dentist in a dental office, and we had one little operatory where the laser was, and we had parents come in with issues, and they say, I think we have a tongue and lip tie concern, and I just took a look. That's how I started, okay? And we've learned a lot since then. We don't just look at something and say that's a problem, because you cannot do that. Sometimes if it looks bad, it probably is bad. Let's be real. If it's right to the tip of the tongue, then the tongue probably can't move, and then you could have some very obvious issues. But sometimes it's a little bit more hidden than that. So a functional assessment is the key to figuring out if this is actually a problem. So that's why we brought in the lactation consultants, because they're going to do a full feeding assessment right before I even walk in the door, and they update me on how that went. So they can say, hey, we got this score for a Hazel-Baker assessment, which is an assessment of the appearance and the function of the tongue on an infant. And then we're able to put the pieces of the puzzle together, and then come up with a plan with the parents based on their symptoms, which we always have them fill out a list of symptoms. And one of them is weight gain, and that's one thing that is not always checked on the list, and that's where and I'm not going to say anything negative about pediatricians here, right? They have a lot that they do really well in this area, and we have a lot of good ones. But they hone in on that weight gain. And if that's not an issue, they're like, well, if it hurts to feed, or baby's swallowing a ton of air and they're fussy and spitting up, who cares? They're gaining weight. Don't mess with anything. Mm-hmm. So that's where we like to educate, like, hey, it's more than that, right? And what about the future? What about growth and development? We want to make sure that there's no restrictions, so that we're setting our children up for success. We can avoid orthodontic work or airway work or chiropractic work, stuff like that, speech therapy.
Issues too. There's so much to it than what meets the eye.
Absolutely.
I love that.
Well,
Absolutely.
Let's dive a little bit more into what you just said, because the immediate need when an infant is coming in is, we need to get them to feed well and mom to not be in pain when she's feeding. But you're talking about even long-term for, school-age kids, teenagers, even adults. There can be so many reasons why a tongue tie revision could be beneficial at an infant age. But then you also do tongue tie revisions for kids and adults. Is that right?
Absolutely.
So let's talk a little bit about the implications of having a tie and what you see in older kids and adults, and then why you release those.
Yeah. So I tell the parents all the time, and a lot of the times when they bring their infant in, they have older kids. So I say, okay, when I'm about to say these things and educate you on what can happen, I hope to the Lord that I'm not describing your other kids, because they hear these things and like, oh my gosh, that's my older kid. The sequence of events usually goes like this. We have problems breast or bottle feeding. And if the tongue can't elevate, then that's where you get that break in suction during feeding, and you get clicking noises and milk's leaking out. So it's all about that upward movement of the body of the tongue. And that's where, we scratch our heads when we hear the pediatricians say stuff like, yeah, they can stick their tongue out, they're not tongue-tied. And we're like, well, okay, that's great, that's good. But what about that upward movement? We want to make sure the tongue can elevate. Because if that tongue cannot elevate, it does not form the upper jaw around it properly. At rest, all of us, so think about yourself when you're sleeping, we should be breathing through our nose. Okay, that's becoming a very popular belief now, and it's supported by a lot of research. So if we can breathe through our nose and our lips are sealed together and our tongue is actually suctioning to the roof of the mouth, it is the scaffolding for that upper jaw to form properly. That means it's going to widen out and it's going to lower. Then we're going to have a nice big nasal passage to breathe even better. And we're going to be healthy because we're going to filter a lot of things through our nose instead of getting sick all the time by mouth breathing and have a dry mouth and dental decay and big tonsils because of that mouth breathing, and not to mention orthodontic concerns. I keep talking here. What was your question? I kind of forget.
Well, it's about what you're seeing symptoms of older adults. And so you're kind of already hitting on it.
Yeah, absolutely. we always say that problems become bigger and way harder to fix. So we do releases on children and adults. And to be frank, again, when I started doing this, I looked at a problem and I saw, oh, I can fix that. I have the tool to fix that. Let's fix it right now. And now we know that that's not always the best option. Sometimes with a lip tie, that's a pretty easy thing. You don't need therapy to kind of move that lip appropriately. But if we're going to try to get that tongue moving appropriately after years of malfunction, and it just is so weak because it cannot move, we need to make sure we do therapy. Myofunctional therapy is what that's called. So we can strengthen the tongue and we can tone it, and speech therapy and stuff like that. So we can actually use the tongue properly before and after the release. With a child or adult, if we can do therapy ahead of time, we're going to strengthen those muscles and we're going to get that tongue ready to go. And then we're going to have a better, safer procedure because those muscles are stronger and we can avoid hitting those and avoid complications that we don't want to have. But we're not only going to do a better release, we're going to have a better outcome.
Right. And we're going to dive more into myofunctional therapy in another episode. So if that's a new term to you or you're just more interested in learning about that, stay tuned for, I believe that's going to be episode 3 in our series together. But with ties, you've mentioned scissors. So your daughter had scissors release. You offer laser. Are those the 2 types? What are the pros and cons of different types of release options?
How much time do you have?
Well, and then at the same time, do you take the same approach? The way you answer this, would it be the same for infants versus adults?
Yeah, great question. I'll give you a quick answer on that. Like to be honest, you can do a really good tongue tie release with scissors. Let's be clear. Okay. Do we see those being done all the time? No. Okay. We see those patients coming into the office after a previous scissors release that was incomplete. And we like to fix that because our philosophy is if you're going to do a release of the tongue, you're going to get all of it. What are you doing a half job for? So we want to not only get the thin webbing that's right to the tip of the tongue, but we want to get every amount of fascia right up until the muscles of the tongue are not restricted anymore. So that's what we're aiming for every single time. The CO2 laser is an amazing tool that allows us to do that so much easier than a scissors. If you take a scissors in a baby's mouth, for example, there's bleeding every time, okay? Usually with the CO2, I have 0 bleeding. So, I mean, imagine the visualization that you can be much safer and more effective and safer. And you're going to be able to get a full release of that tongue. And the upper lip is one that a lot of times it bleeds a lot when you use the scissors. And that's why doctors shy away from that. And then it's not addressed until later in life when they have a big gap in their teeth and, speech concerns and stuff like that. So we don't want to be hindered by the tool that we use. So that's why we have that CO2 laser. And that's why we love using it. So we can get a full release. It can be really safe and really effective. And we feel like I would never use anything else on an infant.
What about recovery too? Is there a difference in recovery between the scissors and the laser?
It's a good question. There's less, and let me kind of talk about the third type of treatment real quick.
Sure.
So diode laser is, everyone thinks a laser is a laser. Well, that's not at all true. A diode laser, you can also do a very good procedure with, let's be clear. If you know what you're doing, it's all about the provider knowing what to look for and do a good job. But a diode laser is like a burning tool. It heats up a little glass tip with laser energy, but it doesn't allow the laser energy to get out. And then you burn tissue with it. Okay, it's kind of like an electrocautery tool, and it has a lot more thermal damage and a lot more pain afterwards. Studies have shown that than a CO2 laser. So we want to make sure that we are as safe as possible, and then we have a lot less discomfort and collateral damage with the CO2 laser.
Wow, that's really interesting. And can you walk a little bit through what does recovery look like? So if a parent is listening to this, maybe they're pregnant right now, maybe they have a kiddo and they're like, I'm wondering if they have a tongue or lip tie. So you do the release, and then what does recovery look like?
Yeah, and let me just first start with, I think one of my main goals in my career is to have every infant, I should say, in the hospital after they're born evaluated just real quick. You can spot a really obvious tongue tie, but without even hardly looking. But if you know how to look, and these hospital systems that start doing that, we can actually help get ahead of all these things. So that's a main goal that I have. And if you're a parent out there and you're wondering if you want to get ahead of something, first of all, schedule an appointment with a lactation consultant before you have the baby and learn about breastfeeding because it is hard.
Mm-hmm. Yeah.
Amen. Yeah. So we started offering that too, and we're bringing lactation services to the area. And obviously there's really good lactation consultants out there. So find someone that you're comfortable with and learn ahead of time. First of all, it's what we wish we would have done as first-time parents. And, but then if you have concerns, and you think, maybe feeding's a little bit uncomfortable, or is it going well? Follow up with your LC, your IBC LC preferably, but otherwise any lactation support is better than none. And if you can come to a place like us, and we can evaluate for a tongue and lip tie, peace of mind, I always say, is better than anything else. Because if we look and there's not a problem, which we definitely see once in a while, that's great news for the parents. We're like, hey, there's no structural issue here that we have to take care of. Great. But if there is, darn it all, let's get it fixed right away.
So what percentage of babies do you feel like are born with ties?
That's an interesting question, and there's some research that shows it's anywhere between 4 and maybe up to 20%. I think about 40% of people have restricted tongue mobility to some degree. Now, does it affect everybody the same? Absolutely not. Are there people that I see that have restricted tongues that are pretty functioning really well with speech, and we don't have any dental concerns, and they're sleeping well? Absolutely. It's restricted to some degree, but is it causing an actual issue? And that's why we go back to the definition of a tie. Is it a problem or not? And if it's not a functional issue, then we don't worry about it.
Sure. Well, then circling back to the actual journey that a parent might experience. So my daughter's tongue was released with scissors. And then our follow-up was that we had to basically massage the area to make sure that tissue wasn't growing back, which was really hard as a parent because they're crying, they're screaming during that time frame. And you have to kind of do that to make sure that that's going on for a few weeks, if I remember correctly. Is that the same process for laser? Has anything changed with what recovery looks like?
Yeah, we modified the stretches over the years a little bit, and we're a little bit less aggressive, I'm going to say. We don't rub on the wound or scratch it or anything like that. We want to avoid doing that. But
that's a relief to hear, because that was horrible.
Mm-hmm. Yeah, I've been there. With my kids, that's exactly what we did. All 3 of them, we had to do those things. But it's hard, but the beautiful thing about a breastfeeding baby or a 1-week-old baby or a 1-month-old baby is that you're going to do the stretches, and then you're going to feed. You're going to latch, and baby's going to calm down, and so are you.
Yeah.
It's so comforting to be able to do that. If you got a 1-year-old or a 2-year-old, imagine how that goes. Like, you're going to stretch their mouth out if you can, and try not to lose a finger, when you're doing stretches and get your finger gnawed off. But yeah, it becomes much harder, and that's why we like to fix things right away, because it's tough to do that on your baby. But at the same time, we do that. We hold your hand through it. We do a 1-week follow-up appointment always, so we can support your lactation support if we need it. Otherwise, we're going to look at the wound and make sure it's healing appropriately and give you some pointers. You're going to watch us do it again after a week of practice, and you're going to say, "Oh my gosh, I'm not pushing hard enough." And we're going to say, "Yeah, you're not." Or we're going to say, "Hey, you're doing a great job. It looks perfect. Keep up the good work," and go from there. But we try to hold parents' hand through it, and we got videos, and we give out paperwork, and we explains it step by step, and we show them in the office too right after the procedure what it looks like and what it should be like for their infant and what their recovery should be like. So they're gonna scream their head off. Be aware of that, but then they're going to recover relatively quickly. You can snuggle them and skin to skin, warm baths, feed them, stuff like that.
So if a kiddo like my son is 9. We didn't identify this when he was younger. We actually do myofunctional therapy exercises,
awesome.
But he hasn't had his released. And I would probably have to get it reevaluated to see if he's at a degree that it needs to be released. But for him, he's not at the toddler age where he'd be gnawing my finger off, but he would definitely fight the process.
Yeah.
And so what do you recommend from, if you kind of miss that window of when they're babies, they're not quite adults yet, when is the appropriate time to do a revision if it is suitable for that kiddo? Is it just like as soon as possible and you just figure it out with the recovery piece, or is it like a certain age frame?
Yeah, when we get a kid that's around age 9, like you said, it's so much easier of a procedure. First of all, if we have myofunctional therapy on board, so that's awesome that you're doing that. But then if we can accomplish the goals of function, if it's sleep or if it's feeding or whatever the concerns are with just the therapy, then we're going to be off and running. But if we need a release to facilitate that treatment, that's what we like to say to parents, like, hey, the treatment here is the therapy. Let's remember that. I know we're going to talk about that in another episode, but if we need a release to facilitate that treatment and accomplish the goals of it, then we can approach it that way. And let's be real, a 9-year-old with stretches and stuff like that after, the thing that you're going to like about this is that we're going to have a really compliant patient that's comfortable with someone in their mouth because they're doing therapy, right? And we're going to do a release. It's going to go great because they're going to be numb and they're going to be just fine. We're not going to have any bleeding, and we're going to stitch it shut if we do a tongue tie release. And so guess what? Everyone's work and pain gets a lot easier and less pain when you stitch something shut, because you're going to have primary intention wound healing instead of secondary intention. It's not going to heal by a scab because it's going to be like a surgical cut, and it's just going to heal real quickly. So we always stitch it if we can, no matter what age. We've done that on 3-year-olds before that are really compliant. I mean, It doesn't happen every day. Usually that's not what happens. But so the recovery period is less for those patients if we can stitch them together. And there's 4 days right now, and these develop and change all the time, those protocols for after, but we have 4 days where we don't mess with it and do aggressive stretches after. So you don't have to worry about it for 4 days. And that's a huge relief to parents if we can get good stitches in there. But follow up with your myofunctional therapist to make sure that they're on top of having you do certain movements and with your new tongue that you've never been able to do before. So that's how it works.
Okay, that is very helpful just to understand. And just to kind of like back up and take a 10,000 foot view of this journey, and to reiterate the different services that you have in your office and why you have them is, so if a family has an infant, they're concerned, their first step would be contacting you guys and meeting with a lactation consultant, and they would be the ones to do the eval. And then they would meet with you based off of the recommendation of the lactation consultant?
Yeah, great question. So we always schedule, if this is after baby's born, because if it's before baby's born, it's a prenatal visit and they'll handle the whole thing. The lactation consultants are great. After baby's born, we schedule a 90-minute appointment. 30 minutes with the lactation consultant's feeding assessment, and then I'll do 30 minutes of education and the exam and the game plan. And then if we do something that day, then 30 minutes of, showing stretches and feeding afterwards. But that's how it works.
Okay. And then above infant, so for kids or adults, would you be their first step then? Is just you would look at them, or do they still meet with someone like a lactation consultant?
Yeah, we haven't even talked about her yet, but we have a speech therapist that we just hired, and she's a certified myofunctional therapist as well. But she does exactly what the lactation consultants do, but she just does it for the older kids. So age 1 and above, Addie will take a look and do a functional assessment, screen for sleep disordered breathing, and then I'll come in and I'll get her report and we'll talk about a game plan, take a look, and that's how we do it.
Perfect. And you also offer a free office tour. Is that right? If anybody wants to come in and just check you guys out and learn more?
Anybody and everybody. We love visitors.
Cool.
Awesome.
If someone listened to this and wants to contact you, what's the best way to contact?
Yeah, our website is tonguetiewi.com, so you can go on there and find all our information, a lot of really good information on there. Otherwise, the office phone number would be 920-336-6594 with option 2 for the Tongue Tie Institute.
Perfect. This was a great intro episode, and we very briefly touched on what we're going to be talking about in our next 3 episodes as well. So we're going to be diving into lactation support specifically in its own episode, as well as myofunctional therapy. And then you guys will definitely want to stick around for our airway chat, because that is probably going to change your life if you've never heard an airway conversation and how important that can be for adults as well. So make sure you stay tuned for those episodes coming up. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.